One of the well-known forms of NRT, or nicotine replacement therapy, is the patch. It's been available on the Canadian market for a number of years and has helped a lot of people to successfully quit using tobacco products. It can increase your chances of being able to quit, and it can also be used in combination with any of the other products that are available. It contains some of the nicotine that smoking or using a tobacco product would. It might not replace all of the nicotine that a person is used to experiencing. So it's really taking the edge off, giving them time to feel comfortable so that they can work towards being able to reduce or quit. In particular, the patch provides a very slow and steady dose of nicotine into the bloodstream. Comes in a number of doses. Some work over a 24-hour period, and they come in 7 milligram, 14 milligram, and 21 milligram. Normally a person starts on the higher dose and works down to the lower dose. Also available in a 16-hour patch, which contains 5 milligrams, 10 milligrams, and 15 milligrams of nicotine in the patch. When people are using a nicotine patch, it's important to know where to apply the patch. It can be applied anywhere from the neck to the waist, front or back on the body. Common places that people like to apply them are on the arm, the upper arm, inside of the arm. And you just want to be sure that you're applying it to a place that clothing will not rub, because that would affect how it sticks and how much nicotine is being released into the system. They also come in clear patches or flesh-colored patches that have different adhesives. To open up the patch, you rip the package open, don't cut with scissors. Take out the patch itself from the container, being careful not to touch the medicated side. And then I'm going to apply it to my upper arm, right here. I'll put the patch on and hold it for 10 seconds. That ensures that the adhesive is warmed up and has a good chance to stick on before I start moving around. Once I can tell that the patch is safely on and it's going to stick well, it's fine to use when you shower, bath, or go swimming. The clear patch, as you can see, is quite discreet, and some people like that because no one can tell that they're trying to quit if they're concerned about that. Side effects of the patch are local irritation that some people might experience due to the adhesive or the drug being absorbed through their skin. The nicotine itself could cause people to feel lightheaded, dizzy, have a fast heartbeat. If they think those things are happening, they should remove the patch right away. In general, the patch is left on for somewhere between 16 to 24 hours. If people are experiencing sleep difficulties, such as extremely vivid dreams or unable to fall asleep or stay asleep, they should remove the patch right before they go to bed. The only problem with this is when they wake up in the morning, they won't have a supply of nicotine in their bloodstream, and they may have to take other measures to ensure that first thing in the morning they've got the nicotine they need to help them stay tobacco-free. Another important thing to remember is if someone has to go for an MRI test, they would need to remove their patch, because there is some metal in the patch, even though it doesn't appear to have that, and that could cause a burn to occur for someone. How do you dispose of the patch when you're done once you take it off? Because there's still nicotine left in the reservoir of the patch, it could cause harm to an animal or a pet if they got it and chewed it. So it's important to take the patch off, put the two sticky sides together, and put it in a container that you can seal. This ensures that even if it's in the garbage, they're not able to get into it and chew it. After you've applied the patch, you want to be careful not to touch your eyes or mouth or nose, and wash your hands thoroughly. The patch is a really good system for helping a lot of people to quit, and as I mentioned before, it can be used alone or in combination with other products to help people quit or reduce the amount they are smoking with the aim of quitting.